Good afternoon, everybody. Thanks so much for joining me here on Wave Now. I'm Myra Ansari. We finally made it to Friday, and I'm actually really excited to talk about this topic because it hits close to me. I have a family member, my grandfather, who passed away several years ago. He suffered from Alzheimer's. And if you have a loved one who is going through that now, maybe if you've had a family member or someone you know who is going through Alzheimer's, please share your thoughts and comments about how that was for you. I know it can be a very difficult process when you see someone going through that situation in life. It's heartbreaking. My grandfather was a very strong, supportive person, and to see the decline that Alzheimer's did to his life was absolutely heartbreaking. So that's why this news that's coming out this week is very exciting for a lot of people. There's a proof that there's a study that the Alzheimer's drug Lecanemab is being hailed as a momentous breakthrough for people who are going through Alzheimer's. This is the first drug to slow the destruction of the brain in Alzheimer's, and it's been heralded as momentous. So today I'm very excited to talk to Dr. Greg Cooper from Norton Neuroscience Institute. He is joining us today. Dr. Cooper, thank you so much for making time for us to talk about this. When you heard about this drug and how it was possibly making a difference for people, what was your reaction and what are your thoughts about it?
I think it was probably a mix of excitement and cautious optimism. If all the findings hold, this is the first time in my career and in the field that we've had a medication that can potentially slow the progression of this really very difficult disease.
Now, can you just kind of give us a little background on Alzheimer's? What does it do to the brain?
Sure. So Alzheimer's disease is a progressive degenerative disease of the brain. It's actually thought to start up to 20 years before we ever see symptoms. What we think happens, although this is not entirely settled, we start to develop plaques or accumulations of a protein called amyloid, or sometimes called beta amyloid in the brain. And as that accumulates, that can become toxic to brain cells, and we see brain cells get sick and eventually die. And as that happens, we start to see the symptoms of Alzheimer's disease. So, for example, more difficulty forming new memories. So we're more forgetful, we repeat ourselves. And over time, other areas like difficulty navigating, difficulty managing day-to-day activities, really a whole host of cognitive changes.
When most patients come to you with Alzheimer's, what are their options for, help me understand this, Dr. Cooper, there's no cure for Alzheimer's, correct?
That's correct. So as of today, there are many things that we can do to help manage the disease and make life better. We don't have the cure for it. So, for example, when I see someone, there are medications that I can prescribe that can help with the symptoms. And for some people, that can be very significant. We can work with our rehabilitation specialists, physical therapists, occupational therapists, speech and language pathologists, and that can be helpful. We can pull in assistance from social work or case management to help make sure there are resources or support in the home. So there are a lot of things we can do, but we're just managing the symptoms of the disease right now. And what we're really waiting for are new treatments that can really slow and ideally halt the progression of the disease. That's really what we want.
So kind of stop it in its tracks, right?
Exactly right.
Okay.
Right.
So what can you tell us about, from what you've looked into, this medication called Lecanemab?
Right. So right now, we don't know everything about it, but it really does look potentially to be very exciting. It's a medication that attacks amyloid in the brain, this protein that accumulates in the brain, and it, we think, leads to everything else that we see in Alzheimer's disease. When people receive this medication, we know that it removes amyloid from the brain. So, for example, there is a type of scan that's really done in a research setting that measures amyloid in the brain. After people receive this medication for 18 months, if you repeated the same scan, you no longer saw that protein in the brain. So we know it can do that. Now, there have been other medications that appeared to remove amyloid, but didn't really help. In this case, not only did it remove amyloid, but when different measures were used, looking at cognition, looking at memory, looking at ability to do our normal day-to-day activities, all of those measures seem to show a benefit from this medication. In other words, individuals that were started on this medication declined more slowly. They saw about a quarter less decline on this medication than had they not received this medication.
Okay, so phase 3 results of this medication, they've been published in the New England Journal of Medicine. And it also suggests that 18 months, that at 18 months, lecanemab was associated with more clearance of amyloid, which is that protein that you were talking about associated with Alzheimer's, and less cognitive decline. So that is, at 18 months, that's pretty significant.
Well, that is significant. And while we don't know this, the hope would be that at 24 months, at 36 months, that difference becomes even greater. Again, we don't know that, but that's the hope of a medication that truly slows the progression and clears the amyloid. Perhaps the benefit becomes even greater with long-term use.
Okay. Dr. Cooper, we have a question from someone joining us here on Facebook. Her name is Kathy Delbruce. First of all, Kathy, thank you for asking a question today. She wants to know, what are the side effects of lecanemab?
So that's a really good question. With all of the medications in this same category, our main concern has been something called ARIA. And not to get too complicated, but that essentially means changes we see on an MRI scan, either of swelling in the brain or small areas of bleeding or hemorrhage. And that can be relatively common. In some medications that have been tested, that may be 20 to 30%. In this particular trial, it looked like that ranged from around 12 to 17%. So a significant number of people had this abnormality on MRI. Fortunately, about 3/4 of those individuals had no symptoms at all. We would only know it because we did an MRI scan. So it seems to be common. It doesn't seem to be a big problem for most people. Nevertheless, about 3% of people really had symptoms from this, and that may mean increased confusion. It may mean blurred vision. It may be headache. It may be any number of symptoms like that. And that's something we're really going to have to watch for. So it's not clear how common that'll be. And the early results seem to indicate that will be uncommon, but that's something we'll have to follow carefully.
Okay, Kathy, thank you so much for your question. I hope that we answered it for you. And Dr. Cooper, I'm glad you mentioned some of this, because this is still kind of in the testing phase, right? This is not a medication that you can prescribe to patients right now. We still have to do a lot of research.
Well, that's true. And so at this point, they've completed a phase 3 trial and they've shown benefit. Typically, that would mean that they can now apply to the FDA for approval of the medication. The FDA would appoint an independent committee to look at this and make a decision. And then if they decide, yes, it looks effective, we want to approve this medication, that would probably be sometime later in 2023. The maker of this medication has indicated that by sometime in March, they hope to apply to the FDA, submit all of their research data, and ask for approval. So we may be able to have this medication available later in 2023.
That's not too far away.
No, it's. I would like it to be next Monday, of course, but these things take time, and we want to do it the right way. You really want experts around the country and even around the world to really look at this data carefully and make sure it really holds up to their scrutiny.
Doctor, I would think that, uh, tell me, how long have you been practicing medicine, if you don't mind me asking?
Sure. For around 25 years.
25 years. So, when you see a disease like Alzheimer take a toll on people's lives and the ones around them, it's emotionally just heartbreaking. To know that in the years that you've been practicing medicine, that there is light at the end of the tunnel, doctor, that you may have something to give to your patients to help them. How does that make you feel personally, to be able to practice medicine in a time where we can help people?
It is enormously exciting, and that's why I am excited. I am cautiously optimistic. Uh, I have participated in research trials for really all of my career, and there have been other instances where we thought we had a breakthrough and we didn't. So my field is littered with a lot of heartbreak. So I'm excited to think that we may finally have a real breakthrough. Now, this is not the final step. This may well be a very important step forward, but I hope that there are many more to follow. I really dream that in my lifetime, we will have the cure for this disease. This isn't a cure, but it could be a major step forward.
And can you just talk to us a little bit, doctor, about, when do most people show signs of Alzheimer's? Does it affect men versus women more? At what point do people start to notice? Okay, do they themselves notice it, or do the people around them notice it more?
It's so it's hard to give a definite answer to that. I would say the majority of people that I see begin having symptoms in their 70s. But I've diagnosed this disease in individuals in their 40s. Thankfully, that's very, very uncommon, but it
Mm.
can happen. But it usually is a disease that affects those over the age of 65 and particularly over the age of 70. Usually, it is a condition where it's our friends and family that notice it. So, for example, if I think that I'm having symptoms of Alzheimer's disease, the odds are actually very high that I don't have Alzheimer's disease. On the other hand, if I think that I'm doing perfectly well and my family is noticing changes, that's a point that I would be much more worried. It usually is going to be more apparent to those around us than it is to ourselves.
And is it forgetting the small things, the big things, just a mix of
It,
things?
it's really a mix. It's I think one thing that's important to realize, we're not meant to remember everything. The great majority of what happens to us every day, we don't remember.
Okay, that's good
So
to know,
so
because sometimes I wonder what's happening to
no,
me.
we all do. We all do, and that is normal. So it's important not to get too worried about every little thing. Most of those are normal. What we're really looking for is a significant change. And with a condition like Alzheimer's disease, it's our recent or short term memory. So if I fail to remember something from 20 years ago, that probably is just normal for me. If I'm developing Alzheimer's disease, what I'm really having trouble is remembering the conversation I had earlier in the day, recalling where I put something earlier in the day, recalling something that happened yesterday. And again, just to caution you, we all will forget those things. I will forget a great number of things today.
Hmm.
So you don't want to get hung up on any one thing. But if there's a clear change, particularly in terms of recent or short term memory, that's when we would start to worry about it more.
Okay. So, doctor, if someone's watching this today and they want to find out more about lecanemab, should they go to a doctor like you, Norton Neuroscience Institute, and say, "Hey, I know that this drug is on the horizon, and also this is specifically for people who are in the early stages of Alzheimer's," right?
That is correct. So, in terms of looking for information, the Alzheimer's Association tends to be a wonderful resource for information like this. And so that's a way you could connect online. And certainly seeing a specialist like me, I think is reasonable. Uh, you're right. This is really targeted for people early on. So it will be for individuals that have a condition called mild cognitive impairment, which is a condition where we have problems with memory, not to a degree that we would say someone has dementia. And some subset of those individuals are at high risk for Alzheimer's disease. So it would be for them, or it would be for individuals who do have a diagnosis of Alzheimer's disease, but it's very mild. Unfortunately, for individuals that have moderate or severe Alzheimer's disease, this doesn't look like this is the medication for them.
But that could come down the road, right? We could be, we're not, this is, things have progressed so much, so there could be hope for those folks.
Yeah, that's absolutely right. So what is true today hopefully will not be true tomorrow, and hopefully we'll just keep making those advances.
All right. We have another question. First, thank you, Galina Goldentul. I hope I'm saying your name correctly. Thank you for your question. She wants to know, other than the common signs being memory loss, are there any physical signs? That's a really good question of Alzheimer's.
That's a great question. So the answer is typically no. If there are any physical signs, that should alert us to some other explanation. And there are other causes of memory loss, there are other causes of dementia. But if someone is having real physical signs, particularly early on, we would think about other conditions like stroke or vascular disease or Parkinson's disease or other conditions like that.
Okay. Galina Goldenthal, thank you so much for your question for Dr. Cooper. Debbie Presley wants to know, what's the difference between dementia and Alzheimer's? That's a really good question.
That's another great question. Think of dementia as really an umbrella term. And there are multiple individual causes of dementia. So Alzheimer's disease is the most common cause of dementia and accounts for probably 60 to 80% of dementia. But there are other causes of dementia, such as vascular dementia, dementia with Lewy bodies, and so forth. Dementia means this. Dementia means that I have an impairment in cognition. That may be memory, it may be language, it may be my executive function, my ability to plan or organize. I have some impairment of my cognition to the degree that I need help with my normal day-to-day activities. So that's a very broad term. Alzheimer's disease is the most common individual cause of that dementia.
So Alzheimer's comes before dementia?
Alzheimer's disease. So Alzheimer's disease is a type of dementia.
Got it.
So if I have Alzheimer's disease, then I do have dementia. That's the individual type of that dementia.
Understood. Okay. All right. And a shout out to Pam Ritchie. She said, I worked for Norton Neuroscience Institute Resource Center. Wonderful place for resources. I'm sure Pam, Dr. Cooper would echo that message today for our viewers.
Yes, I will tell you. I was fortunate enough to join the Neuroscience Institute a couple of years ago, and the resource center is just phenomenal. And I can take no credit for it. I have nothing to do with it. It's just an absolute pleasure to work with them.
Do you want to talk a little bit about that, Dr. Cooper? Is the resource center a place where folks who want to know more can go and get more information?
So yes, so the resource center is part of the Norton Neuroscience Institute, and they really provide a absolutely phenomenal array of resources, not just within dementia or memory disorders, but across neurological illness across the board: multiple sclerosis, Parkinson's disease, dementia, almost anything you can imagine. And they provide educational resources. They're have a number of classes that they hold, whether it be, for instance, something we've started on the memory side is called a caregiver training workshop. And people come for about half a day and hear various of us talk and help people through that process. They have exercise programs, they have Tai Chi classes. It's just, I couldn't begin to go over all that they do, but it really is an incredible resource for me selfishly as a clinician, but also for Louisville and our entire region.
Um, Dr. Cooper, are there any, like, is Alzheimer's something that you can say, oh, it runs in my family, my grandfather had it, so will I get it? Or is it something, do you have to have some type of conditions that can kind of make you more susceptible of getting it? Does that question make sense?
Yeah, it does make sense. The answer is a little bit complicated, I'm sorry to say. It does run in families, and we do inherit a higher or lower risk of Alzheimer's disease. With that said, I may have a very strong family history and never develop Alzheimer's disease. I may have no family history and develop Alzheimer's disease. So it's that risk. I inherit a higher or lower risk. Now, if I have other health conditions like diabetes or maybe high blood pressure, that will put me at a higher risk for developing Alzheimer's disease or even other forms of dementia. Doesn't mean I will get that, but it does put me at a higher risk for that.
Okay. And I want to get to one more question because we are running out of time. My Zoom clock is telling me we've gone quite a bit. This has been great, Dr. Cooper. Debbie Presley wants to know, if I have a family member with early onset Alzheimer's right now, would they still be a candidate for this new medication? Now, it all depends on when we can have access to this medication, right?
That is exactly right. So now we have to be careful there. Some people by early onset, they mean developed Alzheimer's disease before the age of 65. Some people mean by early onset mild Alzheimer's disease. If it's mild, then the answer is potentially yes. That individual would be a good candidate for this medication. But then you are also correct. It depends on submission and approval by the FDA, and then following that, hopefully approval by insurance companies. And I think if the FDA grants full approval, it would be difficult for CMS or any other insurer not to cover this medication.
That's good. Okay. Dr. Cooper, is there anything about Lecanemab, Alzheimer's, that I have not asked you that you want people to know?
Um, that's a good question. I'm not sure. In terms of lecanemab, I don't think so. I think this is very, very exciting. I think we have to use a little bit of caution. We don't know everything yet, and certainly there are risks that go along with this. But as I've told some people, this feels different than anything that's come before. So I'm optimistic this will hold up, this will be approved, and within the year, we will have an important new treatment option. So I think that is important. I would also tell people, with or without this medication, it's important to seek evaluation, diagnosis, and care early on. We don't have the cure right now, but there are things that we can do that can meaningfully help both the individual with Alzheimer's disease and with their family. And I think we really have to understand this isn't a condition that just affects individuals. In fact, it affects entire families. And if we recognize it, if we start treatment, if we provide support, we help with all that planning, we can make a meaningful difference. And so I'd encourage people, if they have any concerns at all, really have that checked out.
And one last thing I wanted to ask you, Dr. Cooper, what advice do you have for families or for people who are witnessing somebody go through Alzheimer's? What should they do? What should they not do to help them through this difficult process?
Well, I think the first thing is to get a good evaluation. And while it may be a minority of cases that we find another answer, and up to maybe 10% of people, we will find an explanation that's not Alzheimer's disease that we can treat and reverse. So you don't want to lose that possibility. And then once you have a diagnosis, you want to be able to start treatment as you can, but you also want to really have the proper support and safeguards around people. I have seen many people that had relatively mild Alzheimer's disease, but because it wasn't addressed, because the safeguards weren't in place, that individual really went on to have major medical issues. On the other hand, if we put those safeguards in place, we have a better chance at trying to preserve that quality of life. And ultimately, that's really what it's about. We want to have the best quality of life as long as possible. And getting the care, getting the support, and educating yourself about the disease can really make a difference there.
Absolutely. Dr. Cooper, I have to say, I think this has been one of the most insightful conversations that I've had. I think you definitely helped our viewers. Debbie Presley said, thank you for having this broadcast. It's been very helpful. So I appreciate all that you do for folks here in our area and for educating us about Alzheimer's and this potential new drug that could hopefully change a lot of lives in our area.
Well, thank you. It's been a real pleasure being here.
All right. I'm Myra Ansari with Dr. Cooper from Norton Neuroscience Institute. If you have any concerns or questions, please visit Norton Neuroscience Institute where you can get more information. And maybe if you have a loved one who's going through this, please visit Dr. Cooper, and I'm sure that he'd be happy to help you and your family out. I hope you have a wonderful weekend. I'm Myra Ansari. Have a great day.